It's week number 36 of the coronavirus pandemic here in Los Angeles. And let me start off by talking about where I left off last week's video, the possibility of a coronavirus vaccine. Now, if you remember last week, I said Pfizer had a coronavirus vaccine that was about 90% effective. Now, fast forward to this past Monday, November 16th, Moderna, which is an American biotech company that focuses on drug discovery, drug development, and vaccine technologies, announced that day that their COVID-19 vaccine is about 94% effective, which is much higher than the Pfizer one. And it shows in its early data that it works in some way in preventing COVID-19. So that is good news that more other companies are trying to develop their own COVID-19 vaccine with a higher success rate. However, the good news doesn't stop right there. On Wednesday, November 18th, Pfizer makes a new announcement in which they say that after new data analysis and final test results, they conclude that their COVID-19 vaccine is now 95% effective, which is a 5% increase in which was a week before. Right now, Moderna and Pfizer are the two leading companies in the race in finding the most effective COVID-19 vaccine in a very critical time, because right now the United States is in the middle of the second wave of the coronavirus pandemic, in which we're seeing rising numbers of COVID-19 cases, COVID-19 hospitalizations, and COVID-19 related deaths. And to make matters more interesting, Pfizer is actually taking a step further. They actually want an emergency FDA approval to distribute their COVID-19 vaccines all over the United States to combat the surge of numbers of COVID-19 that we're seeing all around the nation. And not only that, they make a new statement further on Friday. On Friday, Pfizer continues its push in trying to get FDA emergency approval by issuing this statement. They're asking the FDA in seeking emergency use of its COVID-19 vaccine in the United States. And if they get that approval and that green light in developing and producing this COVID-19 vaccine and distributing this vaccine in the entire country of the United States, that they could be available as soon as early December. So that is good news. And they're also asking that once they are in that phase of distributing this vaccine, that the first people that should get administered this vaccine should be the ones of high risk, the most vulnerable people in the community, which is the elderly people, because those are the ones that are dying in the highest rate right now in the United States. Right after them, it would be the frontline workers, which are the people working in the hospital, the doctors, the nurses, the medical assistants, the ambulance workers. Anyone that is in the medical field should have this vaccine to combat COVID-19. They have been in there and fighting this war of this pandemic from the beginning. So it makes total sense for me, and I have no problem for that. So the next question is, will this vaccine be free? Will it be available? We don't know that yet. If it comes true, if they do get emergency approval, who knows? But I think during this pandemic, in this moment in time, it should be a no-brainer. We want everyone to be free from this nightmare of this pandemic. No one should be denied in getting this vaccine, regardless of their social status or their income. Because we're all in this together and we're trying to beat this virus. And the only way to beat it is to work together. And hopefully this vaccine works, because I'm still a little hesitant that it's only 95% from this Pfizer vaccine. I wish it was 100%. or even 99%, because 5% is still not enough in my eyes, but who knows. Right now they're trying to get the approval. We'll see what happens, and hopefully I'll have more information as the weeks goes on. Regarding the coronavirus here in the city of Los Angeles, the number of cases and hospitalizations are surging at this very moment. We're seeing on an average 5,000 new confirmed cases per day all this past week. And it's still increasing, and experts predict that if new shutdown measures are not implemented soon, we might see double or triple those numbers. And not only that, the health and medical experts are actually kind of worried that the Los Angeles hospitals could get overwhelmed. So we're in a very bad state at this very moment all over Los Angeles. And not only that, it actually looks much worse for the state of California. Speaking of the state of California, the situation here is actually much grimmer than I anticipated. The first thing is coronavirus related, but to a different degree. And I'm talking about the elected officials, the public officials, not following what they're preaching. There are two examples. Number one, the governor of California, Gavin Newsom. He was caught going to a dinner party that had too many people that were not social distancing. So the first mistake was going to a dinner party that had too many people, and the second thing, not social distancing or even wearing a mask. That is very irresponsible and stupid. So much that the governor actually had to go to public and actually apologize to the entire state of California for not following what he was preaching. Because he's the governor, it's the highest office in the state. And he's implementing these rules that we all have to follow. And if you don't follow the rules, what makes you think we're going to follow the rules? And that's the big problem. People are very lenient to the rules. They don't see the consequences until it's too late. The second example is that a bunch of elected officials actually went to an excursion to Hawaii during a pandemic. And they were not social distancing. They were not wearing a mask. And probably some of them even have COVID, and now they're spreading into a state that have low numbers of COVID. So that's even more irresponsible. So this is where I'm saying it's not enough to preach. You have to practice what you preach. If you're an elected official, you have a moral obligation to make sure that you follow the rules the same as everyone else. If you're implementing rules, you have to follow those rules. No one is the exception. So that's the first thing COVID-19 related that went on in California. The second thing is because of these increased numbers of cases and hospitalizations throughout the state of California, the governor actually issued a new limited stay-at-home order effective immediately. So this is what it said. So the new California limited stay-at-home order says that all non-essential activities have to stop from 10 p.m. to 5 a.m. It applies to all counties. It was effective on November 21, 2020, and it's going to last for over a month. All activities from 10 p.m. to 5 a.m. are often non-essential or gatherings that spread COVID-19. And the reason why is because they want to reduce the movement of mixing of household. Protecting essential workers dramatically slows the spread of hospitalizations and deaths. So that's the reason why that this stay-at-home order is in effect. Regarding the coronavirus here in the United States, according to the Johns Hopkins University, it actually has surpassed a grim milestone of COVID-19 cases just this week alone. So the United States has surpassed 12 million confirmed cases. And that was actually a jump of 10 million cases just last week alone. So that means 2 million more Americans got COVID-19 in this 1 week alone. And something else was that it actually has surpassed 250,000 deaths since the start of this pandemic. The United States continues to be the number one country in the world that has the most cases and the most deaths regarding COVID-19. And not only that, on average, so far, over 1,300 Americans are getting COVID-19 a day. That is just such a worrisome trend that is going right now. And the CDC and the other public health departments are urging all Americans to stay vigilant during these last days of fall and entering the winter months, because it's going to get much worse. And they're asking to please wear a mask, social distancing, sanitize, wash your hands, everything that you can possibly do to stop the spread of COVID-19, and to stay home during the holidays. It is a bad idea to travel at this very moment, especially in other people's houses, in which you may not show any symptoms of COVID-19, but you might have it, and you could accidentally spread it to others. So, again, urging all Americans to do their part in the fight against COVID-19. So that is it for today's video, and I actually wanted to add one more thing. I actually went to the store earlier today, to a Target store. I actually wanted to buy a couple things before the start of Thanksgiving, and I was also looking for some paper towels. But guess what? I couldn't find any paper towels, and to make matters much worse, all the toilet paper were out. Panic buying has come back again. And not only that, people are hoarding again. So I talked to the manager from Target, and they said that they've been out for the entire week since the announcement that the second wave had started here in the United States of the pandemic of the coronavirus. So now we're back to where we were the early months, where it was very hard to find any type of toilet paper, and now you're seeing them being sold online for outrageous prices. And again, they're asking people to not panic buy and to not hoard. There is plenty for everyone. And people shouldn't hoard things, especially where everyone needs those essential items. So hopefully people listen, but we will see, and hopefully I can find some. I still have plenty, but it still surprised me that people are panic buying once again. And lastly, hopefully, we get better news on the race in finding the best vaccine to administer to finally put an end to this pandemic nightmare. So hopefully, Godspeed to all those scientists that are working tirelessly in finding that 100% or 99% cure for COVID-19. So everyone, stay strong, stay safe.